And here we go. Welcome to Baptist Medical News Network. I'm Rhonda McRae. Thank you so much for joining us today for our live webcast. Our topic today is Merry Christmas to Me, Part 1. We're talking about Botox injections and injectable fillers to help with wrinkles, facial wrinkles, and techniques for having a younger and fresher appearance. And so here to help us today, we've got our plastic surgeon, Dr. William Wallace. Thank you for joining us today. We're so glad you're here and looking forward to hearing what you're saying.
Thank you, Rhonda.
Before we get started on that, our 3 usual housekeeping issues that I need to tell you about. First of all, you can post a question for Dr. Wallace at any time during this live webcast. We're going to go through our questions first, and then at the end, if we have any questions posted, we'll get back to those. And we know we do have one question already that we're going to answer. But go ahead and post those questions now. You can do that by scrolling to the bottom of the screen where you're watching this now, and you can leave a comment, and then you'll need to refresh your screen to restart the webcast. So you can go ahead and send those questions in now. Secondly, during the live webcast, you're going to see some advertising scrolling across the bottom of your screen, and that is paid to Ustream TV, so it is not connected with Baptist in any way, but it does make our live streaming possible, so that's what the advertising is about. And last, we are recording this webcast, so if you have a friend that you think would benefit from seeing the webcast and hearing Dr. Wallace's comments about our topic today, then at the end of the webcast we're going to put this up on our website so you can see the recorded version. To watch that and any of our other previous webcasts, you can go to www.mbhs.org/mednewslive, and you'll be able to see those recorded events. So we'll go ahead and get started then. And so let's start off by talking about Botox. Okay.
All right.
And so just talk, basically, let's define it. Tell us what it is and explain how it works.
Okay. Botox is a toxin from a bacteria, and its action is on muscle fibers and the nerves going to those muscles, and it basically causes a paralysis of the muscles. It was used for several years in non-cosmetic situations by a variety of physicians who had specific muscle areas that they needed to paralyze to help a situation. Then it was moved over into the cosmetic field, and at this point it is used to inject areas where there are creases or wrinkles, specifically on the face, that these wrinkles or creases are caused by constant muscle action. The areas that I limit my Botox injections to are the area between the eyebrows that people get the fairly deep creases from scowling or squinting. And those creases are caused by muscle activity on either side there. And you can inject Botox into this area. It will paralyze those muscles. Once the muscles are paralyzed, you really are not able to squint, or you're not able to scowl, so that the creases begin to soften. Now, if the creases are really ingrained, they're not going to go away completely, but they're going to significantly soften. The second area that I typically will do Botox injections is along the forehead. Again, the horizontal creases that people develop across their forehead are secondary to the muscle activity under the skin there. And if you can paralyze those muscles, then again the horizontal creases will begin to soften and become less obvious. The third area that I typically inject is along the lateral aspect of the eyes, the so-called crow's feet, little creases there, and they again are from squinting and the muscle tightening along there, and we will inject a little Botox right along there, paralyze those muscles somewhat, and then those crow's feet will begin to soften and become less obvious.
So the squeezing, that would be like the motion, like if you're in bright sunlight.
Correct.
Yeah. Okay.
Yes.
All right.
Yes.
Okay. I'm very familiar with the vertical lines in between the eyebrows. I know how you get those.
Yes. Yes.
Okay. Excuse me. Need that. All right, so you've answered my second question. That was exactly what I was going to ask, where they were commonly used and where they're most effective. Let's talk about...
Let me add one thing
Okay.
to that, Rhonda, because we get asked a fair amount if you can inject Botox into the cheek areas to try to help these crease lines along the mouth.
Okay.
When you see some of the entertainment personalities on television, you get the impression that they have had Botox injection in those areas because they have almost a look of a paralyzed face and they can't move. I personally don't like that, and I have avoided injecting into anywhere of the lower face. I inject the forehead, the area between the eyebrows and the lateral eyes, but when patients ask for injections along the cheeks and the mouth, I really have avoided that.
Right, you don't recommend that for that very reason.
I think you lose, I mean, you could do it, but I think you lose the animation of your face, and it's a sort of an obvious look.
It would affect your ability then to have a nice big natural smile?
Correct. Yeah. Yeah.
Well, I can see why you wouldn't recommend that.
Right.
Well, so they're most commonly used on the upper, above the cheek, and that's where we think you recommend it for the most effective.
Correct.
All right, so we've been talking about, or we've kind of promoted this webcast as Merry Christmas to Me, planning for events in 2010. So if we have somebody who's watching now or maybe going to see the recorded version later that maybe has a big event like a wedding or a class reunion or something in 2010, and for her Christmas stocking she wants a gift certificate for Botox, when should she have it done in relationship to when her event is? How much lead time? That's the kind of question I'm trying to ask.
Okay. Basically, when we do the Botox injections, it's a series of multiple injections to make sure that we have gotten the toxin into the muscle area so that it's paralyzed. And for instance, if we're doing the area between the eyebrows right here, it may mean anywhere from 4 to 6 injections in that area. Forehead, again, probably 6 to 8 injections, and maybe 2 on each side by the on the lateral parts of the eyes. Now, each of those little injections, when it's done, will leave maybe a little bit of a bruised spot or a little bit of a swollen spot. The swelling around the injection site usually is gone in 12 to 24 hours. The bruising may be 2 or 3 days, but certainly in 24 hours you can put makeup over the area and cover the bruising. For that reason, you obviously need to do the injections at least several days before an event. But the other thing is that we know that the effect of the toxins on the muscle doesn't really reach its full effect for about 7 to 10 days. So again, if you're going to have it done, you need at least probably 7 to 10 days. But even more important than that is what we've said is that you paralyze the muscles. Then, since the muscles don't work, gradually over several days or weeks, the creases sort of soften and blend out. Ideally, I think 2 weeks to 3 weeks before your event.
Okay, that's when you get your kind of
best results.
Okay.
Yes, and by that time, all of the the indications that you had the injections should be gone.
Right.
And then you're also getting the maximum effect on the muscles and the creases.
Okay, so 3 weeks, 3 to 4 weeks.
3 to 4 weeks
Okay,
before.
all right, and that's plenty of good planning time. So
Correct.
That's great. Well, then that leads to another question. How long do the good effects of Botox usually last?
The teaching and the product information says that the Botox will usually last for about 3 months.
Okay.
And then the effects of the toxin will wear off the muscle activity will come back, and you're right back like you were.
Mm-hmm.
I have found clinically that most of the time it's around 3 to 4 months, although it could last. I've had some patients that it'll last up to 5 to 6 months.
Okay.
On the good side of that is that with it being relatively short acting, 3 months like that, if you don't like the effects of it, in 3 months it's going to wear off,
right.
and you're going to be back just like you were, no worse. The creases are no worse than they were. In fact, they're probably a little bit better.
Mm-hmm.
On the downside, with it being effective for 3 to 4 months, it means that if you like the effects and you want to continue this, you're probably looking at about 3 times a year
right.
of having an injection.
Right. But if you just have the one event you want to look particularly fresh for,
yeah, right. If you're doing it for a one-time thing, you can certainly do that. You can, and then when it wears off, you can wait, and when you have another event or something that you want to do, then give yourself a lead time of 3 to 4 weeks and have it done.
That's a good plan.
Mm-hmm.
Well, what about any possible side effects?
On the Botox, the only real side effect is that if you paralyze the muscles of the forehead or the areas between the eyes, it sometimes will cause the brows, it'll relax your forehead, your brows may drop down. Mm-hmm. And again, if you have been, as we age and some people develop extra skin of their upper eyelids, we end up going around holding our forehead up mm-hmm. all the time to keep our eyelid, keep that skin out of the way. If you paralyze this and that relaxes, it may appear that you've got more extra skin of your upper eyelids that's getting in the way, and that's not it's not a terrible side effect, but it is something to be aware of.
It does its job on the forehead, but it has an impact on
the eyelids. Correct.
Well, this actually kind of touches on the question we've had: can Botox help with the drooping eyelids and the sort of heaviness?
Uh-huh. And it really cannot. If anything, it may actually make it worse, like you said. Mm-hmm. About the only treatment for the excess skin of the upper eyelids and the heaviness and mm-hmm. drooping is surgical excision of that skin.
Okay.
And eyelid surgery.
Right. Okay. Mm-hmm. Well, then that leads really to another question. Is it possible to have some unrealistic expectations of what these Botox injections can do and can't do? How would you address that? What is a reasonable thing to expect from a Botox treatment? Mm-hmm.
I think the most reasonable expectation is that you will, if it's effective, basically your forehead and the area between your eyes is going to be paralyzed so that you really cannot squint. You will lose the animation mm-hmm. of your forehead, mm-hmm. but in return you should get a fairly smooth, improved appearance of your forehead and the area between your eyebrows with less of the definition of those creases. And as I've said, the creases may not completely go away, but they should be significantly softened mm-hmm. And all. So, but I guess the biggest unrealistic expectation is that those creases are going to be totally gone and that they're going to stay gone.
Right.
And the reality is that they will soften, they will be less noticeable, but they are going to come back in 3 to 4 months when the Botox wears off.
Okay, all right. Well then, this is an outpatient technique,
yes.
So can a person come and go right back to work? I mean, how long does it take?
They can, as I said, a person, if they get injections into their area between the eyebrows and on their forehead, there are usually little swollen bumps where the injection sites are. That usually takes 5 or 6 hours to sort of calm down. Mm-hmm. Most patients that I do will take the remainder of that day off
right.
from work or whatever and go home. By the following day, they're fine to be out, and there's no problem. But it basically is an outpatient procedure that's done in the office. Generally will take anywhere from 15 to 30 minutes, depending on the areas that we're doing.
Okay. And we talked about this before the webcast, but a question I had for Dr. Wallace, because I'm interested in this, is does it hurt?
And I told Rhonda that the toxin does sting just a little bit as it goes in. The needles we use are extremely tiny, so that the needle itself really does not hurt. But as we put in, each of the injection sites is 1/10 of 1 cc. So it's just a tiny bit, but it does sort of sting as it goes in. I found that patients, it is not intolerable for them. And once you finish, the hurting and stinging is just when you're doing it, and then it quits afterwards.
But there's no sort of topical thing you can do to...
No, with the Botox there really is not. There's no way to numb that up and do it.
So it just has to be prepared.
Yeah, right. Be prepared for a little sting.
Okay. Well, let's talk about cost then. Can you tell us about the costs involved in the Botox injection?
Yes, it works out to about, and this is a generalization,
right,
anywhere from $200 to $250 per area that we do. Sometimes we will charge for each injection. We'll count up the injections. We have sort of, in our office, have sort of rounded it off so that it's per area, and it's around $200 to $250 per area. Perhaps $200, $250 for this area between the brows, another $200 to $250 for the forehead, and then same for the lateral part of the eyes. Now, however, if you do all 3 areas, in our office, it's $575. So it's less. We do give a break if we're doing multiple areas. And it seems like I have a few patients that just come in and we do 1 area, but by and large we're doing the entire, all 3 areas, trying to help the creases on the forehead, lateral parts of the eyes, and then down at the root of the nose.
Yeah. Well, that would make a very good Christmas stocking gift
so you're looking
in
at
there.
right. You're looking at the for the total for 3 areas about $575.
That's very reasonable for a good
Christmas present.
Good Christmas present for 2010.
Yes, absolutely.
Well, insurance doesn't cover any of these costs. Is that correct?
That's correct.
Okay.
It really doesn't.
Okay.
There are some indications for Botox that insurance does cover. That I said before. Before it really got moved over into the cosmetic realm, it was there were some indications, but they're not really areas that are seen.
Right.
So anything we do with it is pretty much non-covered.
It's a Christmas gift.
Exactly.
Okay, well, let's switch gears then, unless there's anything else we need to discuss on Botox. Let's switch gears then and talk about the injectable fillers. Now, tell me if I'm right about this, Dr. Wallace. That is your recommendation for the areas in the lower part of the face. Is that correct?
Yes.
Well, explain what those are and how they work then.
Okay. The fillers, the original fillers, and everybody has sort of heard and used to talk about collagen. And it was almost like we talk about Kleenex. No matter what the brand or what the type product, it's still Kleenex. And so most people, when you talk about collagen, but in fact we have moved beyond that. And the original filler was collagen. And it was a product made from beef or cattle skin that was denatured, and the collagen from the skin was used, and it was a sort of a white paste. The theory of fillers is that you're going to inject some type of material into the skin, right into the lower layer of the skin, that is going to take the crease and build it up. Okay, and all it is a physical thing to go under the crease, put a filler that's going to push that crease up and make it less defined and less noticeable. And so collagen was the first. They found that the effectiveness of the collagen lasted for about 3 months, and then your body began to break down that collagen.
Okay.
It went away, and as it did so, the crease came back. Companies have since done research trying to develop better and better fillers that, number one, are probably less potentially allergenic to the body, and also are longer lasting. And the most recent generation of fillers, at least that we are using, is made from hyaluronic acid. And this is a compound that is made totally in the lab. It's not from an animal or anything else. And it's more of a clear gel-like material. And again, you inject it into the skin right under the crease to try to build that crease up.
Okay.
And
so the technique is the same, it's the substance is improved.
Correct.
Really.
Exactly.
Okay.
It's the same technique. It is just a better substance that is a little bit more long-lasting and is not. It's basically hypoallergenic.
Okay. And usually right in here.
The major areas that I use fillers are these crease lines that people develop from the base, from the lateral aspect of their nostrils down along the corners of the mouth. The other area that especially women are concerned about as we age and everything sort of drops, you begin to get these creases that are from the corners of the mouth down toward the chin.
Okay.
We call them marionette lines because they're almost like a puppet there. And so fillers work very well to put pressure under the creases here from the nose, and then these along here. The other area that patients sometimes do not like is, and I especially see it in people who smoke, they will get these vertical creases, especially on their upper lip, we think from holding the cigarette in their mouth, and you can inject into those areas.
Okay. So there are a lot of areas where the fillers can have a real good effect.
Correct.
Okay.
And most of it is on the sort of the central lower face is where we tend to get those creases.
Okay. Okay. Well, are there any possible side effects then from the fillers?
There are. I have had, even though the hyaluronic acid fillers are supposed to be hypoallergenic, I have had a couple of patients that tend to get some prolonged redness where we've injected it, and I've had to assume that it's almost like an allergic reaction, and it does go away, and in those patients we just don't inject them anymore with that. The other thing is that you get, again, it's a technique of multiple injections. You're injecting all along the crease, trying to go just in the lower layer of the skin, if not, and sometimes into the fatty tissue under the skin, but you're trying to put a little area of this gel that pushes up on the skin. When you do that, two things. Immediately afterwards, there's almost always little bruised spots and little red spots where you've done it, and that sometimes lasts for 2 or 3 days.
Okay.
The other thing is you sometimes can feel the gel as a little lump or nodule under the skin. Again, over a period of several days, it usually sort of softens and blends out. But patients need to know that for at least probably 2 or 3 days, 4 days, they're going to have something noticeable there. I don't know that they have to stay indoors, but and they can certainly by the following day put makeup over it. But the effects of the fillers, in my experience, don't go away quite as quickly as the Botox.
Okay, so that's probably a case of like the Botox. If you have that done, you probably take the rest of the day off anyway, usually.
Correct, and then you're ready the following day.
Okay.
The fillers, some people by the following day are okay. Others I've had 3 to 4 days.
Okay. Well, so let's talk about it then. I want to think about the 2010 events. You know, we kind of did a timeline for the Botox.
Right.
If you want to have a filler for a 2010 event, when should you plan to have that for the best result and the best effect?
Yeah. It's really probably about the same
Okay.
as the Botox. I would say 7 to 10 days. Whereas the Botox, the immediate after effects wore off, the bruising, the swelling wore off quickly, but you didn't have the effect on the muscle for 7 days. The fillers take a little bit longer for that immediate post injection to wear off, but you get your effects a little bit quicker.
Right.
So it's still probably about 7 to 10
Okay,
days.
so could a person have some of both done during the same visit?
Yeah, exactly. They certainly could, and we often do that. We will use Botox on the upper face, forehead, lateral parts of the eyes, and then come in and do fillers on the creases from the nose and around the mouth, and do all of that at once.
Okay, and then you really probably would want the rest of the afternoon off.
Right, exactly. You would.
Okay. Well, we talked about what might be some unrealistic expectations for Botox, or
Yes.
what's a reasonable expectation for what fillers can do?
Probably the biggest is that the fillers will improve the depth of these creases. And if a person if they have sort of moderately severe creases and want to improve them, sometimes it will make them go completely away or completely correct them, and it'll be the skin will be even and flush with no crease line there. Most of the time, though, if there is a significant crease by the nose or the mouth, the fillers will improve it significantly, but it'll still be there.
Okay.
And that's what I try to impress on patients, that we will improve the situation, but there's probably no way that we're going to completely get rid of those creases.
Okay, so it's an improved and more youthful and fresher, but it's not completely smooth in all cases.
That's correct.
Okay.
Yes.
All right, so how long do the effects last in general?
With these new generations of fillers, such as the one we use is called Juvederm, and it is one of the hyaluronic acids. And I have found that Juvederm lasts usually at least 9 months, but I have had some patients that have gone 12 months, so a whole year. And so basically, it's gotten to where it is sort of a once-a-year procedure.
So that's a real difference between that and Botox, then.
Yes, it is. And the collagen that we first used was only about 3 months. So the newer fillers are probably 3 to 4 times longer acting than the original collagen.
So that's a good improvement over collagen beside the hypoallergenic aspects of it.
Correct.
That's great.
Yes.
Well, let's talk about cost on this then, if you don't mind, Dr. Wallace.
Yeah.
Tell us kind of what to anticipate for the filler injection.
Okay. The fillers, the cost is, it is delivered to us in a prepackaged small syringe.
Okay.
That is 1 cc.
Okay.
And our cost is per syringe, and that's the way we charge to the patient. For Juvederm, the cost of a 1 cc syringe is $575.
Okay.
Most of the time, I can do pretty much all of the creases if a patient has, say, creases from the nose to the mouth and then smaller creases at the mouth. If it's someone with moderate creases, I can usually pretty well do a correction with 1 cc.
Okay.
If, however, we need to go into a 2nd cc, we give a break on that 2nd cc of $475.
Okay.
So it's a $100 decrease for the 2nd cc.
Okay.
The good thing also about this latest generation of fillers is that the hyaluronic acids can be kept in the refrigerator for up to 3 to 4 months and still be safe and effective, whereas the collagen could not. Therefore, if I have a patient that I need to go into a 2nd cc, and to totally correct what
Right.
they need done, but we don't use all of it. We can label it with their name, we can keep it, and in 2 or 3 months, they come back if they need a touch-up or a little bit more, then we do it at that time.
Oh, that's great. So, and that's a good stocking stuffer too, right there, since the effects last. You could do this
Right.
every Christmas.
Right. It's basically probably a once a year.
So that's really good.
treatment. Yes.
And again, I'm assuming this is not an insurance product. This is a Christmas gift.
It is. It is. There are occasionally times when there is some kind of medical indication for using it, but that's extremely rare. So by and large, it's a non-insurance covered procedure.
It's a treat for yourself.
It is. Yes.
But for a 2010 event, it might be a great way to start the new year.
Exactly. And many times both the Botox and the filler injections are an alternative to some type of facial cosmetic surgery.
And compared to that, it's a great way to get a nice result.
Yes,
Yeah.
exactly.
Yeah, okay. Well, we don't have any questions, I don't think. Is that right, Robbie? Okay. Well, then I think we're going to just wrap up. I do want to give you the opportunity, Dr. Wallace, if anybody is watching this either now live or going to see the recording, if they're interested in contacting your office,
Yes.
can you give your telephone number and tell people how to get in touch for these appointments?
Okay. I am with the Clinic of Plastic Surgery. Our office is in the Watkins Medical Building at 1421 North State Street, and our telephone is 601-969-9050.
Okay.
And we have a website you're welcome to go to, and it's the Clinic of Plastic Surgery. I think the actual website is theclinicofms.com, but you can certainly visit our website, and it has most of the information on there that I've talked about today.
Okay, that's great. Thank you, Dr. Wallace. Appreciate that. This
You're
has
welcome.
been very helpful.
Thank you.
And I want to thank everybody for tuning in today, and to tell you to tune back in next month on December 9th at 12:15 Central Standard Time. We're going to have part 2 of Merry Christmas to Me. We're going to have Dr. William Harris. He's a cardiovascular surgeon here at Baptist, and he's going to be talking about treatment for varicose veins and for spider veins. So we hope you will tune in then. And Dr. Wallace, thanks again for being with us today.
Thank you.
Appreciate
Thank you
it.
for having me.
Thank you.